If you've noticed changes in the amount of fluid, or even a complete absence during intimate moments, please know you are not alone. This is an issue that affects millions of men over 50 worldwide, yet very few have the courage to talk about it openly. Studies show that 30 to 40% of men over 60 experience some degree of this change. Today, we're going to talk about the real causes and, most importantly, the practical solutions that actually work. Hello, I'm Dr. Jane Taylor, and here on our Male Secret 60+, we discuss men's health with serious science-based information and zero taboos. As a physician specialized in mature men's health, my mission is to bring clarity to topics many find embarrassing but that are essential for your quality of life. If this is your first video on the channel, welcome. Subscribe now and turn on notifications so you don't miss our weekly content on health, vitality, and well-being for men after 60. Today, we're tackling a sensitive but extremely important subject: reduced or absent ejaculatory fluid in older men. This is something rarely discussed, even in doctors' offices, because many men feel ashamed to bring it up or wrongly believe it's just an inevitable part of aging that has to be accepted. The truth is that while some changes are natural, many causes are treatable, and there are proven solutions that can restore your confidence and quality of life. Throughout this video, we'll understand exactly what happens in the male body that causes this condition, when you should see a doctor without delay, which tests may be needed, and what solutions are available, from simple lifestyle changes to specific medical treatments. Get ready for honest, practical information that can transform your well-being. First, it's important to understand that some changes are perfectly natural with aging and do not mean anything is wrong with you. Seminal fluid production gradually decreases after age 40 to 50 due to progressive hormonal changes, especially testosterone, which drops about 1% per year after age 30. The seminal vesicles and prostate, responsible for roughly 90% of the fluid, also undergo natural structural changes over the decades. A 30-year-old man may produce 2 to 5 milliliters per episode. By age 60, that can naturally drop to 1 to 2 milliliters. This gradual reduction is expected. But there is a crucial difference between a natural, gradual decline and a sudden change or complete absence. That distinction determines whether you need medical intervention or not. When we talk about complete absence of fluid, we're referring to specific medical conditions such as aspermia or retromonary ejaculation, which are different from normal age-related decline. Aspermia, total absence of ejaculatory fluid. Retrograde ejaculation. The fluid is produced normally, but travels backward into the bladder instead of coming out. You feel a normal orgasm, but little or no fluid is visible, or the volume is dramatically reduced compared to what you're used to. In retrograde ejaculation, the classic sign is cloudy, milky urine right after intimacy. That's the semen mixing with urine in the bladder. These conditions do not necessarily affect pleasure or the ability to have satisfying intimacy, but they can have underlying causes that need investigation and treatment. There are many possible causes, and identifying your specific situation is key to finding the right, effective solution. Causes range from side effects of common daily medications, chronic conditions like diabetes that damage pelvic nerves, to consequences of previous prostate surgeries or other medical treatments. Each cause has a different therapeutic approach, which is why accurate diagnosis is so important. The good news, in most cases, there is a workable solution. Let's go through the main causes in detail. 1. Natural aging. The seminal vesicles and prostate slowly reduce activity due to cellular changes and reduced blood flow. The pelvic floor muscles that provide the forceful expulsion also lose tone after 50 if not exercised, just like any other muscle in the body. This is normal, but it can often be managed and even partially reversed with the right strategies. 2. Medications, one of the most underestimated causes. Blood pressure drugs, especially beta blockers and diuretics, antidepressants, especially SSRIs, prostate medications, finasteride, dutasteride, some epilepsy drugs, hormone treatments, and even certain allergy antihistamines. If you started a new medication and noticed the change shortly afterward, this is very likely the culprit. Talk to your doctor about alternatives or dose adjustments. Never stop any medication on your own. 3. Prostate problems. About 50% of men over 60 have some degree of benign prostatic hyperplasia, BPH. The enlarged prostate can compress the delicate ducts. Prostate surgeries, TURP, laser, etc., damage the internal bladder sphincter in 40 to 90% of cases, causing permanent retrograde ejaculation. Other pelvic surgeries, hernia, colon, bladder, can also affect nearby nerves and structures. 4. Poorly controlled diabetes. Chronic high blood sugar causes diabetic neuropathy that progressively damages the nerves responsible for expelling fluid and closing the bladder neck. Men with diabetes for more than 10 years are 3 times more likely to develop these problems. Poor circulation from atherosclerosis, uncontrolled hypertension, high cholesterol, and smoking make it worse. 5. Retrograde ejaculation, specific condition. Most commonly caused by prostate surgery, diabetes, or alpha blocker medications for urinary symptoms, tamsulosin, doxazosin, alfuzosin. Classic sign, cloudy/milky urine right after orgasm. It causes no pain and does not harm the kidneys or bladder, but it may point to underlying issues that deserve attention. 6. Low testosterone and hormonal imbalance. Around 40% of men over 45 and nearly 50% over 60 have suboptimal testosterone levels. Testosterone drives seminal fluid production. Severe deficiency can reduce volume by 60 to 70%. High prolactin, thyroid problems, or low FSH/LH from the pituitary can also contribute. The good news, hormonal deficiency is easily diagnosed with simple blood tests and effectively treated with supervised replacement, when you must see a urologist urgently. Sudden, not gradual change, pain or burning, blood in urine or semen, new urinary symptoms, weak stream, frequent night urination, incomplete emptying, marked loss of desire plus fatigue plus mood changes. The issue is affecting your mental health or relationship. Diagnosis. A specialist will take a detailed history, order blood tests, total and free testosterone, LH, prolactin, thyroid, etc., prostate ultrasound, post-ejaculatory urinalysis to confirm retrograde ejaculation, digital rectal exam, PSA if needed, and sometimes cystoscopy. These tests are quick, routine, and give a complete picture. Treatment options that actually work. 1. Medication review and adjustment. Approximately 25% of cases, switching blood pressure or antidepressant drugs often solves the problem completely. 2. Testosterone replacement therapy. When levels 300 nanograms per deciliter, injections, gels, patches, or pellets. 60 to 70% of men see volume improvement within 3 to 6 months, plus gains in energy, muscle, mood, and libido. Requires regular monitoring. 3. Better control of diabetes, hypertension, cholesterol. Getting HbA1, C7%, and BP 130/80 often brings gradual but significant improvement. 4. Specific drugs for retrograde ejaculation. Imipramine, pseudoephedrine, or clomipramine, taken 1 to 2 hours before intimacy, 40 to 60% success rate. 5. Lifestyle changes you can start today. Stay well hydrated, 8 to 10 glasses of water per day. 150 minutes per week, moderate cardio plus pelvic floor, Kegel, exercises. Quit smoking. Limit alcohol to less than or equal to 2 drinks per day. Maintain healthy weight, 7 to 8 hours quality sleep. Stress reduction, meditation, yoga, deep breathing. 6. Evidence-based supplements. Always check with your doctor first. Zinc 15 to 30 milligrams, L-arginine 3 to 5 grams, vitamin E 400 international units, vitamin D, ashwagandha, CoQ10, selenium. 7. Kegel exercises, pelvic floor training. Contract the muscle you use to stop urine midstream. Hold 5 to 10 seconds, relax 5 to 10 seconds, 10 to 15 reps, 3 times a day. After 3 to 6 months, 40 to 75% of men report stronger expulsion and better control. Emotional and relationship side. It's normal to feel worried, embarrassed, or frustrated. Over 70% of affected men do. This is a medical condition, not a reflection of your masculinity or worth. Intimacy is about connection, affection, and shared pleasure, not the amount of fluid. Talk openly with your partner. Most are far more concerned about your health and the relationship than about this specific issue. If anxiety is severe, a therapist specialized in men's sexual health can be life-changing. Common myths. Busted. Myth. My intimate life is over. Truth. Satisfaction depends on emotional connection and communication, not volume. Many couples report better intimacy after 60. Myth. Nothing can be done, it's just aging. Truth. 60 to 80% of men improve significantly with proper treatment. Myth. Every older man loses it completely. Truth. Huge individual variation. Many men in their 70s to 90s maintain reasonable volume with good health habits. Summary and final message. Gradual reduction is common, but sudden or total absence deserves medical attention. Causes range from medications and diabetes to low testosterone and prostate issues. Most are treatable. Accurate diagnosis plus tailored treatment works for the vast majority of men. Lifestyle changes, pelvic floor exercises, and open communication make a massive difference. You do not have to accept this as inevitable. With the right help, most men regain function, confidence, and joy in months. You deserve vitality and well-being at every age. If this video helped, please hit like. It helps YouTube show it to other men who are suffering in silence. Share it with a friend, brother, or father who might need it. Drop your questions or topic suggestions in the comments. I read every single one. Subscribe to Male Secret 60+. And turn on notifications so you never miss a video. Taking care of your health isn't vanity or weakness. It's responsibility and self-respect. See you in the next video. Wishing you a week full of health and vitality. Big hug, Dr. Jane Taylor.